On Doctor's Diary, Dr. Andrew Mulwa narrates his life and times up to the helm of Makueni County's health docket.
My name is Dr. Andrew Mulwa. I am the Minister for Health Services in Makueni County. I am also the chairperson of the County Ministers for Health Caucus, where I am the co-chair of the Health Sector Intergovernmental Forum. First, I think I decided to be a doctor while I was younger than high school. In my early primary school, in class 4, is actually when I made a decision that I would like to be a doctor. I did my KCSE in Makueni Boys in the year 2000, and I actually scored A's in all subjects. But the Kenya National Examination Council would not believe that we could get A's in all subjects, so they cancelled our chemistry results, and therefore I got a Y. We got a Y because it was said that I showed the other students, I leaked or I showed the other students chemistry practicals, which as far as I'm concerned was not the case. I actually don't remember not just sharing, because I was index 1 and I was seated in a corner alone, and therefore I have to date never really understood what happened. But it was not just me. 99 students of the 139 had their chemistry results cancelled, and was cited as the chemistry practical. And I decided to repeat my KCSE in Machako School, so I went back to Machako School, where I eventually did my Form 4 and scored straight A's in all subjects. It really helped me start appreciating life from a different perspective. That sometimes it is not always what you do that gives you results. Sometimes things that you have no idea of can affect what you do. Was it difficult? I was a young, energetic, innocent young boy. So I did not actually know anything else. So I said, they have not given me my results. I am going to go and do it and prove to them that I had passed my exams. Thankfully, I did even better because I enjoyed and built networks. It also brought some confusion in my pursuit to be a doctor, because after passing my KCSE from Machako School, I was actually offered a scholarship to study architecture in Japan. And I did interviews, I did everything, and I got confused, because sometimes when you are young, there is the excitement of sheer travel to Japan. So I thought traveling to Japan would make me a better person. But I had a conversation with my father then, and he asked me, why have you changed your mind? Why do you want to go to do, other than the scholarship, what else takes you to Japan? Then I could not answer him. Then he told me, you are supposed to be a doctor. Go do your medicine in the University of Nairobi. And I forgot about the scholarship and went for medicine. I was a small boy, maybe the age of 10, 11, while in class 4. I got sick. I think malaria was common then, and there were no dispensaries or health centers or facilities around our home. So you would get sick and you just stay at home, and your body is able to deal with it, and you go back to school or to your normal activities. So this time around I got an illness while in school. Must have been March of 1991. I still remember the date I was admitted in hospital. Must have been the 24th of March. Then I was released from school because I fell ill in school. Went home, and of course my parents could not afford to take me to school, to hospital. So they let me stay at home. After 3 or so days, I got severely sick, and very, very sick. And I think I got what today as a doctor I understand would be febrile conversions. So my parents thought I had actually died, and went to call the village funeral committee chair to come and start preparing for my burial. Thankfully, one of our neighbors who had schooled and knew something about health seeking and had a car passed by, and he found me and the committee starting to plan the burial, and he decided to come and check. Then he realized I was actually breathing, and he rushed me to Makueni County Referral Hospital. Another incident happened in 28th of October 1998 while I was in Form 2 in Makueni Boys. I actually had a previous night which was very good. Then in the morning when we were waking up for preps, I realized I did not have the energy to get out of bed. And I told one of my colleagues who are students with that I am unable to work. So he thought to wake up. So he thought I'm joking, and I did not want to attend early morning prep. So they just went and left me in bed. I later developed what I think was a dysentery or diarrhea or something while still in bed, and I could not move. So I had to soil my beddings, and I stayed there. Guys came for lunch, they went back. No one had realized I'm actually sick. So by the time it got to 7 p.m. or thereabout, I had lost consciousness. I did not know where I was, and I think at that point is when, after games, my fellow students realized this guy must be very sick. Then I was brought to Makueni County Referral Hospital again. I was admitted, and for 2 days I did not know where I was, and I woke up on the 3rd day again. If it were not for the good work of the healthcare workers, I would probably not be here for this interview. Medical school is not easy, but I also enjoyed. I had my good moments in medical school. My best memories in this journey of health is in medical school, because I am those students who would get time to play pool, to run kiosks in the university, to do other things, not necessarily the academia work. But we also worked hard, very hard, to ensure that we registered good grades in the university, and we passed through medical school and eventually without any supplementaries or repeats or rewinds, which is pretty common in medical school. So effort, but I also learned while in medical school to balance between being a doctor and also being a human being, because we participated in many community things. I also had time to go and teach as a hustle, as a side hustle, in some of the colleges in town that were teaching health-related courses. So I was not just a student. I was a student, and I also created some time during free time to go and teach in the evenings, early mornings, and on the weekends. So I also learned politics, joined politics while in campus. I fight for campus rep, I think, while I was in second year, of course, unsuccessfully. The one thing that I did well in medical school is to marry while I was in 3rd year. And I decided to be a father and a husband while in medical school, something that I have never regretted to date. So therefore, I enjoyed medical school. And from medical school, we worked as an intern in Machakos Level 5 Hospital. And there is where now I started appreciating the difference between the theory of class and the practice of medicine. I remember this Easter holiday in the year 2009 when I was on call for surgical department in Machakos Level 5. And I think there were like 6 mass accidents along Nairobi-Mombasa highway, and I was the first on call. And I had to deal with over 250 injured patients over 3 days. So I remember from Friday to Monday, I never stepped in my house, and I was working in theater, between theater, outpatient, the wards, and yeah, and I realized what does not kill you, break you, strengthens you. So I think from that I carried the passion. I was posted to Makueni County Referral Hospital, where I worked briefly and was transferred to Mboni, where I went and was a sub-district hospital then, did not have theater, did not have anything. But when I went there, I committed that because of my passion that I would open up a theater, and I actually started the theater in Mboni. And by the time I left, I was the only doctor in that hospital for 3.5 years. And in those 3.5 years, there is no single day I ever referred a patient because I'm busy. So I used to be called wherever I'm doing, Monday through Sunday I worked. I still remember the first day, the first week that I went to Mboni, and there was this river that had a drift, that when there were flash floods or there were rains, would be flooded, and therefore no vehicles would cross. I had been called to come and assist in referral, and I could not cross the river because I was coming from Machakos, and the ambulance could not cross the river as well. So I could see the vehicle across. I was on the other side, and the poor lady passed on, waiting for the river water to subside, which was very sad. And I think from that moment, I vowed to myself that no single case of cesarean section would be referred from Mboni while I'm the doctor there. So I made sure that theater was operational. I think by the time I left the hospital, I had, with my own hands, done over 6,000 surgeries. In Mboni, I'm very proud of the work that we did, especially all the cases that we did, mostly surgical. I have interest in surgicals. I am most proud of the Makueni Universal Healthcare Program, which is a program that I personally was involved in conceptualization, even writing the concept, the typing work. I did it and presented to His Excellency the Governor as a model that I thought would have far-reaching effects, because when I was working in the wards, while I was working in the clinics, I would realize how we were giving patients a raw deal in terms of you would ask a patient to do an investigation, because as a doctor, you need to confirm a diagnosis. Like you tell a patient, go do an ultrasound. Then when you are in outpatient, you send them for an ultrasound, expecting them to bring the results, the ultrasound results, so that you make a proper diagnosis. The patients will just go home because they do not have the money to do it. If you are lucky, they would come back to you and tell you, we have been unable to get the money. And therefore, sometimes you would manage patients on differential diagnosis because you cannot confirm diagnosis. So I thought about having a program that would ensure that the clinicians seated at the outpatient, in the inpatient, seeing patients, whenever they ask for investigations to be done to patients, they actually get what they require, so that when patients are being managed, the clinician is sure that they are managing that illness. And that's why I thought about a program that would cover our indigents, the people who cannot afford NHIF, the people who cannot afford any form of insurance, to access health without thinking about the depth of their pockets. And that is how we designed the Makueni Universal Healthcare. And it's a program that has had wide acceptance in Makueni and beyond. And I am very, very proud of what it has come to be. Sometimes I even think the program build a conversation around universal healthcare in this country.
Where you are actively involved, it can be you championing for the rights of doctors and whatnot. Are you able to implement some of those things that you were asking the government back then to do?
First, I think not are you able, I have been able to. First, prior to the 2011 strike, which I actively participated in as the chair of the southeastern region of the Doctors Union, the doctors' remuneration was very, very poor. To be honest, what we were paid when we entered service, I look back and say it was actually a joke. Because for a doctor to earn 35,000 Kenya shillings per month, and I don't believe in terms of economies, a lot has changed between 2011 and now, because the wage bill in most of the sectors have remained the same, was actually a joke. So one, I was concerned that the remuneration that doctors were getting that time was very, very poor, vis-a-vis the work that they do. And a lot of times, that time, doctors were resigning. And we actually had many opportunities to go and work in the private sector, in the NGO world, that were paying up to 10 times our current salary then. So the one thing that made me continue working in the public sector is the realization that, one, I come from a humble background, and my people cannot access health elsewhere other than public facilities. So by my resigning, I would have denied people from similar background access to doctors. So I chose to stay. And when it came to issues of agitation, I decided to agitate from within. In terms of the work, the current work I do, there are many low moments. There are many, many low moments. And it is not because of what, it's because like now, when, and I want to talk about the story of devolution and how many things that we have done here in Makueni, and sometimes, not sometimes, many places across the world, the country, devolution has really changed the way health is done. But there are moments that I feel like we have lost it, because there are still issues within the devolution arena that make Kenyans feel and ask, would we be better if health was not devolved? And when that conversation, because I hear it a lot within healthcare workers, within communities, I ask myself, is it really me, or is it really the devolution, or is it the people who are charged with devolution that may not be doing what is supposed to be done? Because to me, devolution is the best thing that has ever happened to the health sector. The doctors' strike of 2016 and 17 was also a low moment for me. The lower moment was when, because I'm on the government side, our colleagues thought I am part of the people who are pushing the doctors to be put behind bars. That was actually paradoxically a very, very low moment for me, because I think we could have done it in a better way. I think we could have managed that strike in a better way. When there are those almost 1,000 or 1,500 doctors stomaching, is the pay increase worth it? Because we have doctors who are jobless. We have doctors who will, today, if given an opportunity to take half of the salary that the doctors were able to negotiate after the strike, they will take it. So did we gain or lose? So to me, that still bothers me. My daughter is a candidate this year. She is 13, and the small one is 7 years. I think I was fortunate to have a young family early. So my family understood. Even when I had my traditional wedding, which is Rurasho, I actually asked my in-laws to allow me to rush to Mboni and do an operation for a patient who needed emergency intervention. And it actually happened. My in-laws were not sure. They thought I had run away from the traditional wedding. But my family understood. They stood by me. They have been a motivation. They have been the source of my strength, because they asked me to go get it. And I think they understand that I am 100% committed to service to our clients, our patients. So of course I know, looking back, my young children would have spent more time with their dad, but I have chosen to spend the time that I get with them, but as well dedicate myself to service of the people of Makueni, or the community that I serve.